Those are actually lovely cloths. I really like how the gents actually did all the cloths and everything. It looks so nice and so original, and I mean, wow, those are masterpieces, man.
A big shout out to Ferson and Tana as well. They literally right after the interview, they came over my place and decided to give me a clock as well. I wish I brought it, but it's a little bit too fragile and I don't want to break it or anything. But it's really, really beautiful, so do check them out.
High society, Zoe, that's
design. But yeah, guys, moving on to something that's a little bit more serious and obviously affects more. Not so much on the men, but more for the women, because only 1% of the world population is affected, or for the men that is affected by breast cancer. But for us, it's super duper crazy how some people. So I was watching an interview this morning, and it says that a lot of women, when they think they have breast cancer, or they have gone through the stages, they don't go to the hospital, or they don't get checked early on. They actually get checked later on. So it is something that a lot of people are not really being proactive about it when it comes to breast cancer. Normally, rule of thumb is that when you will get diagnosed when you go and see the doctor when something is up. But that's what we're trying to find out. That's what we're trying to, bring the awareness out, because it's October, because it's the pink month. It is the breast awareness month here, and we have together with us in the studio to talk about this is Dr. SALADINA JASMIN, consultant breast and endocrine surgeon from the Beacon Hospital. Good morning, doctor.
Good morning. Thank you for having me.
Yes, you're dressed up all pink. I love it.
Oh yeah, of course. She fits the theme. We didn't get the memo though. I mean,
yeah, we had to go a little bit
It's a pink October month.
So. Exactly. We have another week. But we actually have a stat here. So breast cancer is the most common and accounted for 34.1% of all cancer among females in Malaysia. 34.1%. That's a very high number.
It is. It is.
Can you explain to us a little bit about, why is the number so? I mean, I don't want to ask such a generic question as to why, but for me itself, as a woman, why is our number so high?
Actually, if you look at Malaysian population as compared to the Western European countries or even in America, our incidence is not as high.
Okay.
Oh, all right.
Our incidence rate is basically 1 in 20 women with breast cancer, whereas if you look at Northern America, it's 1 in 9.
Wow.
Yeah. So, but in general, if we look at the world incidence, breast cancer is still number 1 cancer that affects women.
Yeah.
Why is that? So there's so many factors why cancer occurs. So, but what we feel that if you look at Malaysian data from 2011 to 2016, that is reported in the National Cancer Registry, the incidence of breast cancer is going up. It's not going down.
Yeah.
All right.
Despite the fact that we are promoting awareness campaign. Well, probably because lifestyle changes. Women make different choices now, and we are a lot more women are going into, I would say, delaying childbearing, delaying getting married, very career-minded. And what our general, we tend to eat out more than, cooking ourselves. So there's so many factors that affects breast cancer. And apart from radiation, I mean, who cannot live without a handphone now?
Exactly.
So it's many factors.
So, I mean, funny you should mention that, because as much as I would want to understand more in regards of how a woman specifically is able to actually get breast cancer, you've mentioned about lifestyle. You mentioned about eating habits as well. It's not just pure genes, isn't it? It's not just something that you inherit from your mother, from your grandmother, and so on and so forth. It's in your hereditary line. It's a lot of factors that comes in play as well.
So when we talk about breast cancer cause, there are factors that you can modify. There are factors that you cannot change. So things that we cannot change is we can't change our parents. We cannot change our genetic heritage. We cannot change that. We cannot change the fact that we're a woman. We're born with estrogen. All that, we can't change that. And we cannot stop ourselves from aging. So cancer generally is age-related problem. But what we can change is lifestyle. So we can control our weight. We can control what we consume. We can avoid smoking.
Yeah.
We can cut down on alcohol beverages. So, so these are the things that we can control.
Yeah.
It is known that breast cancer is higher risk in women who gets period earlier. If you get your period before the age of 11, like 9, 10, so the risk is slightly higher. Or if you menopause later in life, more than 55. So theoretically, it's because of the duration of estrogen exposure to one person that leads to cancer.
Right. That's actually, I'm already, as you're saying it, I'm like trying to remember when was my first menstruation cycle. I'm like trying to calculate.
A lot of women don't really remember,
Yeah.
so I generally will ask.
I remember I was 12. I had an incident
Primary
in
school or secondary school?
Primary
This is how I
school
would
at
actually
12.
answer
You
it.
don't, not after the day I had, you do not forget that type of day.
And I'm
But-
sorry I can't contribute into this conversation because I have no input at all on this. But yeah, but I mean, just to prolong that, I do have a daughter as well who's 11 and who just came into womanhood, if I might say so. I mean, like, this is definitely something I really need to be aware of as well, right? No, when it
But
comes
these
to-
things you can't control. It's not
Yeah.
within your
Sure.
control.
Yeah.
So what we can control and what we can actually advocate as a person is to come for screening.
Yeah.
You get yourself checked early.
Yeah. Get your pap smears done.
Get your pap smears done. Get your mammography once you reach 40. If you are still a young woman and if you do regular breast examination, you do it every month, you would roughly know how your breast feels like, and you feel something off,
Yep.
straight away tell your parents so that they get yourself checked. We can do an ultrasound breast for women who are less than 40 years old.
Yeah.
Not all women that comes to see us gets a mammogram. It is actually age related.
Right.
So because mammography is an X-ray of the breast.
Yeah.
So if you X-ray a tissue that is very dense, in younger women the breast tissue is dense, you don't get much information.
Right.
So you get misdiagnosis. So generally we only start screening with mammography when you reach 40 and above.
Okay.
So younger women can still come for screening, and we will perform clinical exam as well as breast ultrasound.
Right. I'm actually curious. So in Malaysia itself, right? I would say ratio or the rate for women getting breast cancer happens for women who are later, who are slightly older as compared to women who are younger, right? Am I right?
Generally, our incidence, I would say it's between the peak, it's 45 to 55.
All right.
So because our incidence is highest between 45 to 55, it doesn't make sense to do our screening at 50. If you follow the Europeans,
Yep.
the American guidelines, they tend to do their screening 50 to 74. But we bring our age gap younger because our incidence is younger at 45 to 55.
And-
Having said
Yep.
that, we are seeing more and more women that are presenting early, like in their 30s, in their late 20s with cancer. So that is something that we are a bit concerned with.
I'm actually curious for women out there who are not lucky enough to know their heritage, to not know their health history, who are not able to do, those DNA tests and whatnot to test out and to check themselves. Because I'm also trying to think if my family has breast cancer history. So for people who are like me, who don't know much about our family background, don't know much about our health history, how or what's the best way to approach this just to be cautious at an earlier age? Is there a test that can be done? Because I remember there's a BRCA test, but this is all like the information I get are always towards
pieces.
bits and
It's
pieces.
like all over the
It's
place.
more for Western countries, for people there, but not so much on the Eastern countries. So I want to know, as a young woman right now, what should I do and what should I prepare for?
When you talk about genetic predisposition to cancer, breast cancer in particular, there are two types of genetic change that leads to cancer. One is hereditary. You basically carry the defective genes from mother to child.
Yep.
Another type that we commonly see is actually somatic mutation. Your genes just fail you at earlier age.
All right.
So everyone actually, we're all born with healthy protective genes.
Yep.
And these healthy protective genes are supposed to protect us from abnormal cellular changes or cancer cells.
Okay.
So the moment your body produces something that is off. Our own protective genes supposed to deal with it, take care of it so it doesn't flourish. But if you are born with the defective genes, and that is the BRCA gene that you mentioned, then your body tends to fail earlier. So you develop cancer younger, and because you have that defective genes, unfortunately, your cancers are a bit more aggressive. But BRCA gene mutation is not a common thing. It's extremely uncommon. It's only 8 to 10% of the population. It's very rare. So it's not so common that we see. We actually see women without having those genetic genes.
So, me as a father, me as a son, me as a brother, how do I, get them to go for a screening? Because, at the end of the day, I need to look out for this. I'm not experiencing this at all. So I need to look out. I need to advise my mother, my son, my daughter, my sister who are not. When should they go for a screening, and what kind of treatment that they can actually get if you could detect this early in life?
Screening generally, when we talk about screening, we are basically saying go for a check when you're basically well. So mammography is the screening tool that we use for women above 40, like I mentioned earlier. But in younger women, we advocate breast self-examination. And you can do that as early as in your teen years, as early as that. Monthly, regular breast examination you do at home. So when you start, as you grow older, maybe around 20, you can start going for breast ultrasound. As a screening tool, and you can do it once a year, And so generally that it starts from young with regular self-breast examination. We call it breast aware. You're aware of your body. And should you feel anything out of the norm, you come and see the doctor for further checkup. So what happens when someone comes and see us in our clinic? A lot of women, when they come and see us, because they already feel something. And the first thing they think, they are so scared, is this cancer or not cancer? They just want to know that. So what we do is, of course, we take detailed history, we will examine, and then we will send the patient for a test. So mammography is for women above 40, and I generally will send them also for a breast ultrasound, apart from mammography, because Asian women generally have very dense breast. Even at 45, 55, and some women have very dense breast. So doing mammography alone may not be enough. So an ultrasound is a complementary test to pick things up better. So, and following that, we will look at the image and advise accordingly. So should we see anything that is suspicious looking, we will advise for a biopsy. It's a simple needle test that can be done as an outpatient procedure.
Interesting. So talking about, so we've gone the screening, and of course, we've talked about screening, getting what. I want to know about the cure, not cure, the treatment itself, the treatment itself for women out there, because immediately when you think about breast cancer, you're thinking about taking these off, taking your babies off. But that's not the case, right? Can you shed some light to our audience? What are some of the treatment costs that they have to look forward to? They have to be mentally strong to face it.
Okay. The new trend in surgical approach is lesser is better. So why we are advocating breast cancer awareness, asking patients to come early for screening so that we detect early. So if you detect them early at stage 1, or some in stage, we call it stage 0, ductal carcinoma in situ. The tumor is still within your ductal system. It hasn't penetrated through the protective layer of your cells. So generally, if you do your surgery early, your survival is fantastic. You can live like 20 years with breast cancer. It's like becoming like a chronic illness. So surgical approach is still the primary treatment to cure cancer. You've got to cut it out. So between taking out the whole breast versus removing a portion of the breast that has the cancer in it, will depend on, it's very technical, but it basically depends on how big the tumor is, where the tumor is located, whether it's in one spot or many spots. So, sometimes when we have to do mastectomy, we will advise accordingly. But we have a new avenue, reconstruction.
Yeah.
We can give you a new breast
All right.
at the same time where we treat the cancer.
Right.
All right. So
Wish we had more time to
exactly.
actually speak
Wish we
about
had more,
this,
but
because-
final words we do
Yeah.
want from you, Dr. Dina. Maybe you can address to our audiences over here. You know, what are your well wishes? What is your hope and dream moving forward, specifically in the month of October, the breast cancer awareness
Yeah,
month?
I hope to see more and more women
Yeah.
coming for screening so that they get to be checked early. And I'm hoping to see the data 10 years or 5 years from now. We are getting more stage 1, stage 2 instead of stage 3 and stage 4.
Yep.
Right.
So at the moment, 40-something% is stage 1 and 2. Another 40+% is stage 3 and 4. We hope to get more in stage 1 and 2 so that women can live the life to the fullest, be productive. You can live with the cancer and it becomes like a chronic disease instead of a
Lovely.
death.
Yep.
It's not a death sentence.
All right. It's never a death sentence. It's all about getting it early, getting it checked early, knowing earlier.
Getting it treated early is
Yeah.
also very important.
Exactly.
Right.
Exactly.